I would like to address whooping cough, pertussis, because that was also brought up last week. And I happen to have studied this extensively, the history of the different vaccines, and I'd like to tell you about what's happening today. Whooping cough is endemic. I am called from people all over the world who tell me that their babies have whooping cough, that they've been to the doctor several times, the doctors couldn't recognize it, denied it, refused to test for it, and then finally when the parents knew it was whooping cough and they insisted on being tested, that those babies turned out to be positive. In the meantime, they were treated with drugs that not only will not be helpful, but that can be harmful.
Oh.
I've had whooping cough for about a month and a half, and it started off in the summer holidays.
Lauren was premature, so she was immunised in hospital. It's been suggested that perhaps, although it was important that she had the immunisations, that maybe her immune system was not actually fully developed 11 weeks prematurely for the immunisation to have been perhaps so effective.
We thought it was just a bad cough, so I went around doing everything as usual. I went back to school and I had to go to the doctors a couple of times.
It never crossed my mind that she would have whooping cough. In between the whooping cough episodes, you're completely well. So whenever my GP saw her, nothing to listen to on her chest, nothing to look at. She didn't even cough in the surgery. So we gave her some steroids, and over the weekend, instead of getting better, she just suddenly developed the whooping sound, the coughing up of the thick mucus, and then by sort of 2 days later, she was having blue episodes on the back of the hoops, which made me ring my GP straight away and said, I'm really, really concerned. This isn't asthma. She's not getting any sleep. She keeps turning blue. And then he said, well, straight away, of course, I think she's got whooping cough.
It was very frightening because you didn't exactly know what was going to happen, and sometimes I was worried if I was going to stop breathing. When I panicked, that made it worse.
To hear the whooping sound at night, I have never sprung out of bed so quickly, and I think my child is 10. If she was 10 months, I don't know what I would be doing.
One of the best ways to diagnose a cough, and the way we do it, is by listening. So let's listen to this cough.
That's a pretty severe cough, and one clue I hear is that the child's coughing, doesn't breathe in, and then coughs a couple more times, and that's kind of a clue to whooping cough or pertussis. And with that, you get those long coughing spells. It's pretty serious in babies. The problem is the child can't breathe because they're coughing so hard, and sometimes there'll be a little whoop at the end of the coughing spell, a little as they're gasping for breath to get that oxygen back in, and that's one of the reasons it's so dangerous. The children aren't getting oxygen to their brain.
So Jasper, why don't we just kind of walk through it and I'll listen to your heart and lungs.
The whooping cough epidemic was declared after doctors reported a surge in cases of the deadly disease.
And right now, just in the first 5.5 months, as I said, we probably have about half this number of cases, 1,500, and 5 infants have already died, all under 3 months of age.
Babies are most vulnerable because they haven't been immunized and have no natural immunity to fight the disease. An infected baby will get apnea and stop breathing. The state is on track to pass on 9 deaths that were reported 5 years ago during the last epidemic. A typical whooping cough case starts with a cough and runny nose for 1 to 2 weeks, followed by weeks of rapid coughing.
They'll cough so hard they'll throw up. They'll cough so hard sometimes that they just turn red and blue in the face. Older kids will have the characteristic whoop where the disease gets its name, where they cough so hard and then they take a big breath in, which is the whoop of the whooping cough.
Adults get it as well, often referred to as the 100-day cough.
I had one mother in my clinic a year ago who was coughing so hard she broke a rib. So it's that kind of a cough.
Talk about it, but mutant strains have come have been born out of vaccinated populations. Just like bacteria mutate and become superbugs, the same thing has happened in a big way with pertussis vaccines. It's a major problem. It's written about worldwide. There's pertactin, which is an antigen on the bacteria, is not on some of the bacteria that are now these mutant strains. They're producing more toxin. It's much more vicious. We're seeing definitely worse cases of whooping cough, and these strains, it's documented medical literature, have come out of vaccinated populations, not unvaccinated populations. They don't find them there.